before doing any procedure, check the patient's chart as well as the physician's order. Do the hand washing, identify the patient, and introduce yourself. Good evening, ma'am. My name is Razel Catalin from Foundation University, and I will be your student nurse this evening. May I know your name, ma'am?
My name is Michelle P. Cadalin.
How about your birthday?
May 18, 2007.
May I see your wrist? Okay. So, ma'am, we will be doing an assessment of your eyes in order to identify if there is cataract, glaucoma, or there are any other underlying conditions. In order for me to do it, ma'am, I'll be needing your permission since I will be touching you, most especially on your face area. Is it okay with you, ma'am?
Yes.
Okay. So, ma'am, I will be leaving the room in order to gather all the necessary materials. If you want to use the toilet, you may do so in order to avoid any interruption while we are doing the procedure. Going back to the patient's room, we have to ask the name again in order to confirm. May I know your name again, ma'am?
Michelle P. Cadalin.
Okay. So next one is we have to provide privacy to the patient by downing the curtains, and then we have to provide the examination gown. So assuming that I already put the examination gown of the patient, so while doing it, I will be taking the subjective data. Ma'am, do you have trouble seeing at night?
No.
Have you ever had any eye surgery?
No.
Okay. So after that one, we have to take the vital signs of the patient. Assuming that I already took the vital signs of the patient, now I will be proceeding to the assessment. We will be doing the test for distant acuity. Ma'am, I want you to stand here, 20 feet away from the Snellen, and then I want you to read the letters that I am pointing. E, P, F, T, O, Z, P, E, L, D, F, D, C, Z, E, F, D, C, C, Z, E, P, O, D, P, Z, E, L, F, C, P, D, T, E, F, O, F. So the patient's both eyes can see and read the letters at 20 feet, what a normal eye can see at 20 feet without the use of glasses or any corrective lenses. Next one, ma'am, I want you to cover your right eye, and then you have to read the letters with your left eye. E, P, F, T, O, Z, E, L, D, P, D, C, Z, E, F, F, C, P, E, D, Z, L, O, Z, P, E, F, F, O, F, E, C, P, D, T. So the patient's left eye can read and see the letters at 20 feet without the use of corrective lenses or glasses. Next one, ma'am, I want you to cover your left eye and do the same. E, P, F, T, O, Z, E, L, P, D, F, E, Z, C, D, P O Z E F L C F O F. So the patient's right eye can read and see the letters at 20 feet without the use of glasses or any corrective lenses. So next one, ma'am, is we will be doing, I want you to sit, and we will be doing the test for near visual acuity. I will be handling you a printed materials, and then I want you to cover your left and right eye, and then you hold this one 14 inches away from you. The Honeycomb Tourist Inn, duly constituted and registered in the Philippines, with principal address at Rizal Boulevard, Dr. V. Locsin Street, Dumaguete City, Negros Oriental, represented in this agreement by its manager Joey Aldiguer, of legal age, hereinafter referred to as the company. Can you do it, ma'am, on your other eye? You cover it, and then you read again. The Honeycomb Tourist Inn, duly constituted and registered in the Philippines, with principal address at Rizal Boulevard, Dr. V. Locsin Street, Dumaguete City, Negros Oriental, represented in this agreement by its manager Joey Aldiguer, of legal age, hereinafter referred to as the company. Okay, ma'am, thank you. So the patient's both left and right eye can read and see the letters 14 inches away without the use of glasses or any corrective lenses. So next one, ma'am, we will be performing the visual field for gross peripheral vision, and then I want you to stand and cover your right eye, and then please tell me yes if you see my hand on your peripheral vision. Yes. You see it, ma'am? Yes. Okay. I want you to cover your left eye. And just please tell me if you see my hand on your peripheral vision. Yes. Okay. So, the patient's both eyes can see my hand on her peripheral vision. So next one is we will be performing the corneal light reflex. Ma'am, I will be shining a pen light on your eyes. The light was seen in the cornea of the patient's both eyes. The eyes of the patient is aligned. Next one, we will be performing the cardinal field of gaze. Ma'am, I want you to follow the pen light in all direction without any movement of your body, but only your eyes. Okay. So the patient's eye can follow the pen light in all directions. One is we will be inspecting the eyelids and the eyelashes of the patient. So upon inspection, the eyelashes of the patients are equally distributed. The eyelids doesn't have lesion, there is no swelling, and there is no discharge. One is we will be inspecting the sclera and the bulbar conjunctiva of the patient. So upon inspection, the bulbar conjunctiva of the patient displays a fine network of blood vessels, and the sclera is white. Next is we will be inspecting the palpebral conjunctiva of the patient.
So upon inspection, conjunctiva of the patient, the color is bright pink and free from lesion. There is no swelling and there is no abnormalities. We will be inspecting the cornea and lens of the patient. So the cornea of the patient is clear, smooth, and the lens is clear. We will be inspecting the iris and the pupil of the patient. Next one is we will be testing for pupillary reaction to light. So, pupils constrict when the light is shown on them and dilated when the light is removed. We will be inspecting the lacrimal apparatus of the patient. So upon inspection, there is no excess dryness or tearing and there is no swelling. Next one is we will be palpating the lacrimal apparatus of the patient. Okay, so upon palpation, the lacrimal apparatus of the patient doesn't have tenderness and there is no discharge. So ma'am, we are now done with our assessment. Do you have any questions about our assessment before I leave? No. Okay. So rest assured ma'am that all the gathered information is only between you, me, and the physician. And then remove the patient's gown. So assuming that I already removed the patient's gown, I will remove my gloves. Then do the hand washing, and then after the hand washing, document the findings.